Hey guys, it's Dr. Giles here with Aspire Chiropractic. And two of the most common areas of complaints that I see and hear from with my patients are these areas right here. I'm going to show you. Right here, the upper back, right here, and that lower mid back. Now, in chiropractic, we call those the transition zones. Now, let's talk about why. Here's a drawing of our spine. We've got our 7 cervical vertebrae, 12 thoracic, 5 lumbar, and then this is our sacrum down here. The area where those cervical vertebrae transition into the thoracic vertebrae, and then the thoracic vertebrae transition into the lumbar vertebrae, is also the same area where the cervical curve transitions into the thoracic curve, and the thoracic curve transitions into the lumbar curve. These areas right there, we've marked them on the screen so you can see them, are the apex of those curves. What happens is when we have bad posture, when we have bad sitting habits, that area starts to get strained and aggravated. Patients come in and they say, "Doc, I'm feeling so achy and so stiff in there," and the pain, it radiates into the muscles around. It hurts the most when I've been sitting for a long time. Well, let me pull my spine out over here. I'm going to grab this spine, and we're going to talk about it a little bit. So you can see here, we've got our spine with our curves. Right here is our cervical transition zone, our thoracic to lumbar transition zone. Let me see if I can. Watch what happens when we start to have poor posture. Things like our head going forward, shoulders rounding forward. Look at how the spine has to compensate. All right? All that strain, all that pressure is coming right here into that transition zone from the cervical spine to the thoracic spine. Now, let's watch what happens if we're sitting and we're leaning forward even more. This starts to affect into the lower spine, into the lumbar spine as well. Right there, in that transition from the thoracic spine to the lumbar spine, it starts to get even more strain, even more pressure is coming down on it, aggravating all those muscles. And what happens too is these vertebrae, they fixate in this position, they get stuck. And over time, you're just getting more and more pain, more and more discomfort in there. Things like headaches, radiating pain into the low back, down the legs, all that type of stuff. You've heard the saying, sitting is the new smoking. Well, this is the type of stuff that's causing that. So what are we going to do about it? Well, chiropractors, we focus on these transition zones a lot. So me specifically, I check them with every single patient and try and make adjustments in and around those areas to free up those fixations, get the spine mobile, and put some extension into those areas. Secondly, we got to address those muscles that are being strained. They're all inflamed and aggravated. In our office, we use something called soft wave technology. It's very effective. It helps with capillary regeneration, cellular regeneration. It even helps your body create its own stem cells. And that helps to clear out the inflammation and a lot of the strain that's going on there. And then thirdly, for myself, I recommend a lot of at-home foam rolling. With my patients, I like to demonstrate things that they can be doing to roll out these areas, help to restore the curve, and help to take the strain off of those muscles. So if you're wondering about the pain that you're experiencing in those areas, or if you have pain anywhere else, I'm confident that we can help you here at Aspire Chiropractic. So come on in. We're here for you when you're ready to be your best, naturally.